Athena was born with a major congenital heart lesion, and obviously once the neonatal team understood that, they were keen to send out a specialist team to pick up Athena and bring her back to Helen de Vos for a complete diagnosis.
When the physician got the call, we get together and discuss what the possible transport is and what needs to happen while we're transporting the baby. And then we left to go pick up Athena. I talked with the physician there and got information about what had happened prior to when we got there. And then I talked with the parents too, which was a really key point for my diagnosis, because they started to pick up on things, I think even before the physician and the nurses did. They noticed that she was breathing fast. They noticed that she wasn't eating very well. Two big things with a heart defect. And we got her prepped for transport back to Helen de Vos Children's Hospital.
One of the important things that our neonatal nurse practitioners do is to run our neonatal transport program. Of those 1,200 babies that we care for here every year, 250 to 300 of them are born in other hospitals and need our expertise. And so we send our neonatal transport team out to pick them up. That is led by our neonatal nurse practitioner. There are not a lot of neonatal nurse practitioners in the country. They are very high in demand. And so we thought, what better way to have a steady supply of the nurse practitioners that we need than to be able to grow our own, so to speak.
Nurse practitioners in general around the whole of the hospital are absolutely vital to our daily function. We can't get by without them, and therefore their training and the quality of their training is absolutely paramount. The fact that we can support nurse practitioner training specifically for neonatal intensive care unit vastly improves the quality of the care that we can offer for small children.
It is supported completely by philanthropy, and we are so grateful for that. And what this philanthropy does for us is it takes experienced neonatal intensive care nurses and allows us to send them back to school to become nurse practitioners. After they complete their nurse practitioner program, which takes about 2 years and prepares them to be master's prepared and a neonatal nurse practitioner, they come back for at least 3 years and work full-time in our NICU, caring for the babies that we have here.
Being a nurse practitioner is something I wanted to do when I was in undergrad. And part of it is just getting enough skills before moving on to that next step of getting a higher degree. So this program really helped me to expand on my degree and further my education and become a nurse practitioner.
There's a real symbiosis between the work of the foundation and the philanthropy that we receive and the programs that we use here at Spectrum Health. By investing in the education of these nurses so that they can become nurse practitioners, we're making a real investment in our community.
Athena's really done very well since surgery. She's robust. The heart is working perfectly. The repair is anatomically, structurally just right. So we're really pleased with her. And she's made great progress since surgery. When we go to see her, she's nearly always asleep because she's got a lot of food in her belly, and as newborn babies are, and she looks very happy, particularly when she's in her parents' arms.